Today's Focus News. Positive rapid test counts as a confirmed case. The Central Epidemic Command Center announced yesterday that, starting next Thursday, people who are in home isolation and who have tested positive for the COVID-19 rapid antigen test will be counted as confirmed cases. Currently, close contacts of government-mandated or spontaneous home quarantine require more accurate but time-consuming PCR to be confirmed positive. However, because PCR sites are overcrowded, people returning positive rapid test results starting next week can use the Health.eu telemedicine app to report and be evaluated by a healthcare professional. If their tests are confirmed positive, they will be banned from leaving their homes for 10 days and must follow self-health management protocols for another 7 days, the Central Epidemic Command Center said. The center's head, Minister of Health and Welfare Chen Shizhong, said the new policy would prevent those who returned positive results from rapid tests from flocking to potentially crowded PCR sites. The Central Epidemic Command Center also announced that home-isolated COVID-19 patients can now receive the antiviral drugs Paxlovid and Molnupiravir after 20,000 courses of the drug were delivered to major pharmacies across the country. The drugs were previously only available to patients in hospitals, government quarantine centers or designated hotels. For adults and children of 12 years of age or older who weigh at least 40 kilograms, if they are assessed to be at high risk of developing severe symptoms, Paxlovid may be prescribed for mild or moderate treatment within 5 days of onset of symptoms. Degree of new coronary pneumonia cases disease. Molnupiravir may be prescribed for treatment within 5 days of symptom onset in patients 18 or older with mild to moderate COVID-19 if assessed as being at high risk for severe illness and unable to use other types of COVID-19 medicines. Luo Yijun, Deputy Director General of the Centers for Disease Control, said people with new coronary pneumonia are considered high-risk groups if they are age 65 or older, current or former smokers, have a body mass index higher than 29, or have certain disabilities. He is also the Deputy Director of the Medical Response Department of the Central Epidemic Command Center. The list also includes people with mental illnesses such as cancer, diabetes, chronic kidney disease, cardiovascular disease, excluding high blood pressure, chronic lung disease, tuberculosis, chronic liver disease, dementia, schizophrenia, and autoimmune diseases, Luo said. Luo Yijun said COVID-19 patients who are isolating at home can schedule a doctor's appointment through the Health.eu app or local health authorities, where they will be assessed to determine their eligibility for antiviral drugs. After getting a prescription, patients can arrange for the pharmacy to deliver the medicine or have someone pick it up for them through the Health Friend app or by contacting the pharmacy directly. Luo Yijun added that a list of pharmacies participating in the program can be found on the website of the Federation of Taiwan Pharmacists Associations. Luo Yijun said that Taiwan has only used 947 courses of Paxlovid and 468 courses of Molnupiravir, and has delivered 370,000 and 5,000 courses, respectively. Taiwan yesterday reported 30106 new cases and 5 deaths from the disease, its single-day number of COVID-19 cases surpassing 30,000 for the first time. The 5 deaths were 2 patients in their 70s who had received 2 or 3 doses of the COVID-19 vaccine, and 3 other patients in their 20s, 50s, and 80s who were not vaccinated. The Central Epidemic Command Center said the patient, who was in his 20s, had a neurological condition and had been bedridden and relied on a ventilator for a long time before contracting COVID-19. The Central Epidemic Command Center also reported that 67 patients had moderate symptoms and 6 had severe symptoms. Of the 3,035 domestic cases reported yesterday, New Taipei City topped the list with 1,122 cases, followed by Taipei with 6,422 cases and Taoyuan with 4,870 cases. 12 cases, 1,776 cases in Taichung, and 1,136 cases in Kaohsiung. Today's news glossary. Accurate. Across. Adult. Announce. Another. Antigen. Antiviral. Appointment. Arrange. Assess. Association. Authority. Autoimmune. Available. Ban. Because. Bedridden. Blood. Cardiovascular. Certain. Chronic. Command. Condition. Confirmed. Considered. Contact. Contract. Control. Coronary. Country. Count. Course. Crowded. Current. Currently. Deliver. Delivered. Dementia. Department. Deputy. Designated. Determine. Develop. Diabetes. Directly. Director. Director General. Disability. Disease. Domestic. Dose. Drug. Eligibility. Epidemic. Evaluate. Exclude. Federation. Flock. Found. Government. Government mandated. Group. Home isolated. Illness. Include. Index. Isolate. Isolation. Kidney. Lung. Major. Management. Mass. Medical. Medicine. Mental. Moderate. Neurological. Overcrowded. Participate. Patient. Pharmacist. Pharmacy. Pneumonia. Positive. Potentially. Prescribe. Prescription. Pressure. Prevent. Previously. Professional. Program. Protocol. Quarantine. Rapid. Receive. Received. Rely. Report. Require. Respectively. Response. Result. Returned. Return. Risk. Schedule. Schizophrenia. Spontaneous. Starting. Surpassing. Symptom. Telemedicine. Time-consuming. Treatment. Tuberculosis. Vaccinate. Vaccine. Ventilator. Website.